A patient today asked about Seroquel or Quetiapine. Seroquel is a second-generation neuroleptic, which is used in many different psychiatric illnesses. In fact, it's FDA approved at lower doses to treat anxiety, at medium doses to treat bipolar depression and bipolar mania, and at higher doses in schizophrenia. And so it's a medication that affects dopamine receptors, so it has some D2 blockade, but it actually affects various different serotonin and other receptors as well. And at different amounts of medication, it seems to do so differently, where you get the response to different psychiatric illnesses at different amounts of the medication. Seroquel is really one of the more effective, I find it to be one of the more effective second-generation neuroleptics or medications for bipolar depression in particular, but it can be very helpful in a lot of these illnesses. It does have side effects, and so it's something that if someone is considering this medication, it's very important to discuss with their provider the risks and the benefits of the medication. Seroquel can be rather sedating, and so it's often taken at night, which can actually be really helpful for sleep. So a patient may say that part of their illness, one of their symptoms of their illness, is that they have a really hard time falling asleep or a real difficult time sleeping through the night. While I do not advocate for using Seroquel or an antipsychotic for someone if their primary issue is just insomnia by itself, if they have a mood disorder that's affecting their ability to sleep, it may be reasonable to use Seroquel or Quetiapine, especially if it's FDA approved for the underlying reason why they're having insomnia. So it is rather sedating. Some individuals, when they first start it, will have some excessive grogginess in the morning after taking it. So I usually start someone off on a pretty low dose and then have them titrate it up as it's tolerated. And usually that extra sedation in the morning or when they first get up wears away with time as their body adjusts to each increase in the medication. As a second-generation neuroleptic, when someone's on this medication, you have to monitor their weight. Not everyone on this medication will have weight gain. Many individuals will not have any weight gain, but you do want to check your weight every once in a while to make sure it's not causing significant weight gain. These medications can cause changes in your blood glucose level, and so your physician will want to monitor your glucose or your A1C, which is a measure of your average glucose over the last 3 months. They'll also likely want to do a lipid panel to take a look at your triglycerides in your blood and other kind of markers for elevated lipids. And they'll want to monitor blood cell counts. So it's rare, but some individuals have drops in their neutrophils or certain white blood cells that could affect their immune system. And so you want to be careful about that, mindful about that as a possible side effect. There are obviously other side effects of these medications. Again, you want to make sure that if you're considering taking Seroquel or Quetiapine, that it's under the direction of a medical or mental health provider, and that you are going to regular appointments and you're taking the medication only as prescribed. If you have any questions about this video, or if you feel that it pertains to you in any way, be sure to speak directly with your mental health provider or to call a mental health provider directly to discuss. These videos are not meant to be medical advice for anyone at all that's watching them. It's really just supposed to be informative in nature and to increase the normalization of mental health and discussions about mental health.